They said she was out in the parking lot and they found her unconscious. What did we do that we said she had what? EMS said they thought she had what? Overdosed. They gave her Narcan. Now, this part of the report gets a little fuzzy. Because about an hour later, one of the nurses said, oh, EMS said it didn't do anything, and the other was like, they said it did. They were getting ready to discharge her. She was up near triage, looked at that nurse, and projectile vomited all over her. In 6 hours after she got to the ER, they took her to the CT. She was having a major what? Bleed. It's too late. Lauren, what did we do? We were judge and jury, right? She's the crackhead. She was out there in the what? She didn't have any history of drug use. It doesn't matter. We weren't what when EMS came in there? We'd already decided. We weren't listening. The best lessons you will learn are from your patients. I had this little old man, and I'm in there doing my things, and I said, I'm listening to you. And he looked at me. He said, do you hear me? That rocked me to my core. Girl, it made me feel about that big, didn't it? You know what I did? I put my stuff down, and I said, I know we ain't supposed to. I sat down on his bed, and I said, no, sir, I was not listening to you. I am now, and what? I hear you. Don't just say, oh, they a crackhead, and EMS said it didn't work. You weren't listening, and you didn't hear them. And they didn't hear the family. Because we had decided what? She's a crackhead. She's on the fentanyl. Her tox screen came back normal. We still judged her. She must take something you didn't know about. Some of them newfangled drugs. 6 hours. And it took her coating the nurse in vomit. And they were like, oh. Now, she wasn't showing any of those signs and symptoms originally. I don't care. If you have a period of unconsciousness, what? They got to get a CT. Whether it's trauma, whether it's just they fell out. DFO, done fell out. CT. Now that doesn't mean that you're going to get an MRI. That doesn't mean you're going to get a CTA. You are going to get what? Tox screen. These are the things we do if you pass out, if you have an altered level of consciousness. If we can't find this, what do? Scratch that off and look somewhere else. Well, they ain't doing that. Scratch that off. What are we doing? We're eliminating things, right? What are my top 3 priorities? Oh, no, they ain't doing that. What are my top 3 priorities? Do you see what we're doing? How do we intervene? We've already talked about this. Neuro assessments, vital signs, ABCDE. Look for signs and symptoms of herniation. You're too late. Midline. I cannot stress that enough for your test. Elevate the head of the bed. Is it 90 degrees? It is not. We're going to go with 30. Administer what? Now, you don't just go in and give 3% saline. Somebody needs to what? That one is not a you just go in and act. Because you have to have a doctor's order for that one. 3%. Maintain normothermic. What controls your temperature gauge? Your hypothalamus and your brainstem. Mainly your hypothalamus. What's getting squeezed? Your hypothalamus. And you walk in and their temperature is 106. You better what? Does anybody know the name of the, it's really cool, it's a big blanket and it's got all these veins that run through it. It is the Arctic, I don't know why, the Arctic sun. Y'all, it will freeze you immediately. Who wants to be a NICU? Do y'all know what we do to NICU babies if we think they have a bleed? Cool their head. Because they can't take that whole temperature. Why would I cool their head? I can get that temperature down without babies can't shiver. Now, if I'm cooling the patient, do I want them to shiver? What does shivering do? Creates heat. You stabbing yourself in the... What kind of medicine do you think I could give them that won't let them shiver? Who said it? Paralytics. And it's a very specific one. This is the only time I've ever given, guys. This is not... Has anybody who's working in the neuro, have you seen anybody give this? It starts with an N. Nimbex. There's a reason. If we're shutting down your metabolism, what's not working that detoxifies blood? Yo, kidneys. Why would I give you a drug that's going to live in there forever? If I could give you a drug that is broken down in the plasma, this is the only one. And that's the only time I've ever seen it. I had to call the pharmacy. What? I'd never given it. And I'm like, hey, I ain't never given this medicine. How do I run it? You can't let them shiver. They might give them the lot, we don't give this drug anymore, Demerol. That's what it's good for, not a whole lot else. What we gonna do? Pads, and they're gonna give them what prophylactically? Keppra, usually. I really haven't seen any other meds. Ensure oxygenation, ventilation, and whatever that requires. If that requires an advanced airway, that's fine. If it ain't that bad, what can we do? Non-rebreather. Put them on a nasal cannula if it's really not that bad. This is going to be that bad. Put them on a non-rebreather. And if they're really bad, bag them until somebody runs in that can intubate them or put in an advanced airway. Guys, this is kind of like the Hail Mary. Does surgery always work? They might get in there and remove a piece of the skull, and what happens? Does anybody know? The brain starts swelling outside the skull. They're not even going to put the bone back on there. They're going to send it back to neuro and what? It's game over, guys. You cannot live like that. Why did it do that? The pressure was so high, and I mean, how would I measure that? An EVD, extra ventricular drain. What is it? This little, it looks like a little piece of metal. I swear it does, like a little toothpick. Where they put it, they got a what? You got to drill a little hole, and they put it in where? That's pretty cool, isn't it? Yeah. Why would I put this? What was the formula for cerebral perfusion? MAP minus cerebral pressure. Now I got both parts of it, right? So if I walked in and my pressure is 2, and I walk back in and it's 30, what's happening is going up. Or the patient is not in the right position. You let the head of the bed down. You got to make sure all that stuff is still there. Did you have a question? Somebody raise their hand. You just start. I think it is. Isn't it MAP minus? Yes. Usually we only know the MAP. What's normal MAP? 60. What diagnostics? What's immediate? CT. If it's real bad, they ain't gonna do plain film. If they just think they might have a little fracture, maybe. But usually you just need to go to CT. Why are you gonna do this? Why are we gonna stick a patient 12 times when the charge nurse knows how to do what? Ultrasound. Why? You're going to give them something to drink and they're going to look like a sprinkler. Why? What's the definition of insanity? Trying something over and over and expecting what? A different outcome. I stick a patient twice and it ain't my day. I'm going to go get her because she's the expert. And if she misses, I'm going to get the ultrasound and somebody that can do it. And it's not me, evidently. This is not an emergent diagnostic. This might be the next day. It might be today if this is not showing anything and the patient, guys, you can't take them down to MRI if they're actively herniating. That's not the place they do. That's not the place we want to intubate somebody. You got somebody leaned through the little hole trying to get them out of and they're trying to get the blade in because the patient's dying. ICP monitoring. Where does this patient need to be? If they had to know, they need to like the Amityville Horror. Get out. What specialty do we not have here? Not neurology, not neurosurgery, not neuro nothing. We used to have a guy that was in neurology, but that was years ago. We don't have what? Somebody to treat the cause. We try to stabilize him the best. You got to go. If you got a pediatric, you got to go. That's not our specialty. That's not the closest appropriate hospital. You got to send them. Now, do they have to go to Vandy? Where else can they go? Skyline. They are a stroke center. They can do everything. What labs? CMP? What if they're bleeding? CBC. Do you know what this is? It's a CT angiogram. What does that mean to you? We talked about this in the lungs. Who said it?
You can see the vessels.
You can see the vessels. So if they just had a little bleed, that's what you do. Like you do this, and the first CT doesn't have what? No contrast. You run them down there and you get them on the bed and they run the CT and the CT tech is like, guys, they see this all the time, and if they look at you and say, you better run them back down there, you better run. It looks at vessels, I'm talking about itty bitty, and they might say, oh, well, there it is. And it's not obvious yet. CBC, CMP, if their H&H is dropping and there's one sign of that, they're probably hemorrhaging. What else? Their GCS is 7. What if that, if you're going to intubate them, ABG. What evaluates your acidosis, your pH, and what? Oxygen, and what else? Your CO2. I'm going to look at both, but what's really important, and you look at that, and they've been breathing 3 times a minute, what are they not getting rid of? Carbon D acid. So now they're acidic, and now their carbon dioxide is 200. What's happening? Massive vasodilation, and they're now posturing. You have to intubate them, and you need to be thinking, I work at Jimmy Stewart. You know who draws the ABGs? The nurses. I'm like, oh, you got it. I know the procedure, but you're going to show me this first. What beds? We already talked about it. Guys, it's, I've only given 3%. Has anybody ever given anything higher? Did y'all see anything higher at Vandy? They make 5%, they make 7%. If this one's dangerous, this one's real dangerous. I have never seen anything any higher than 3%. What's normal saline? 0.9. What's half normal saline? 0.4, 0.9, and 3. It's got a lot of stuff. This is just showing you the ICP monitoring. And sometimes it's long. Where is that monitoring? All the way down. This one? It's in the dura. And it depends on where they're thinking the injury is. So that one's subdural, below it, epidural, above it. What's that? That's bad juju right there, because that's intra cerebral.
It's within the tissues of the brain. That's bad. If you're bleeding in this, and you do that CT, and these are what? White it out. What color is new blood? Stark white. What color is old injury? Black. That's how you tell the difference. Guys, you're gonna have a question. I'll give you the scale. You have to figure it out. Okay? I'm telling you right now. We've already gone. So, verbal, confused, but they can answer questions. They might just be a little bit confused. Inappropriate responses. How would that be? Who's the president, Banana? What color is that, lettuce? Is that the right words? No. They're saying words and you can comprehend. That's not right. This, they won't, nothing. You can't comprehend nothing. What? Do y'all know what the GCS of this is? 3. Everything in here, your books, your book bag, nothing. It ain't moving, it ain't blinking, it ain't verbally responding, there ain't no pain, nothing. What's the highest? 15. Guys, if you walk in and they say, give me a thumbs up. Okay. You at the top. Yep. Purposeful movement. That's that, right? Withdrawals from pain. I kind of move away from you. Abnormal flexion towards your spinal cord. Decorticate. What's lower? Decervin. Nothing. You walked all through things. They ain't posturing. They're nothing. Eyes open to verbal commands. 3 points. Eyes open to pain. I don't know why that's not applied today. I've never noticed that. Nothing. Now, what do I need to make sure they're not getting? Sedation. What do we give patients that seize? Sedation and Keppra. If somebody's actively seizing, what do we give them, Lauren? What did I run to the bedroom to give? Because I looked at this lady, I'm like, hey doc, she's seizing. Ativan. It's a sedative. Can you get a good neuro exam if you give them a sedative? Guys, even if you give them 200 mics of fentanyl, they might be talking crazy. You've got to realize what you have done as far as intervention. If they're on a paralytic, they ain't gonna do nothing. Are they intubated? Are they sedated? So you have to keep that in mind. What causes brain injuries? Head injuries. Fall down, go boom. Diving. In this area, traumatic brain injuries. What else? Car crashes, especially if what? You get thrown out. That's the worst traumatic injury. You're going to see multi-traumas. Do y'all know what the next one is? If the car flips over and over and they are ping pong ball in there. What's a head injury? Injury to the head. Scalp. Right, that's on your head. Skull. Brain. Now, does head injury equal brain injury? Nope. If I just, y'all know what an avulsion is? You got scalped. Ooh. Get back. Guys, these bleed, you can literally bleed to death if it's bad enough. You need to stop it. Your skull is not your brain unless your dura mater is sticking out when you go there and look closed or open. Open. If you have a brain injury, is that a head injury? You had to have had something to do that unless they're having a stroke. We're talking about traumatic brain injury. Something had to have happened to their brain. You shook the baby, you threw the baby up against the wall, I hit Memo in the head with a bat, something. What does this mean? I walk up to him and smack him with a bat. What's the primary injury? The bat hitting his head, the fracture, the brain matter coming out his nose. That's the primary injury. What is a secondary injury? It's what happens after. And it is a coup contra coup, but that's still the primary injury. And that's not good either.
Primary injury still a blow to the head.
It is.
And falling unconscious and then hitting their head again.
That could be another.
Problem.
But you said it exactly right. This is the fallout. What do we say the fallout is? They're not breathing. Their oxygen level is dropping. They're releasing all these toxins. It's an insult to the system. Blood don't go. Oxygen don't go where the blood don't flow. They're going into shock. Primary injury. Secondary injury is what? The fallout. Does the fallout have to happen? No. Where do we need to intervene? We can't stop them from hitting Memo in the head. But we need to stop it where? They don't need to get here. Right? Skull fractures. What's a contusion? A bruise. This is bad. Intra. It's within what? The brain tissues. This is also bad. What is the functional unit of your brain? Axons, dendrites, nerves, right? Nerves, axons, and dendrites make up what? The nerves. What does this word mean to you?
It's spread out.
It's diffuse. We're going to talk about that in just a second. What time is it?
Well, they're blood 48.
Guys, I can't tell you how bad they bleed. Major complication. Why it is? We got thrown out in the field, and we got what in there? Calpoop. Calpoop is not indicative of a good outcome. So what's our priorities with this patient? We need to stop the bleeding. But what else? They gonna need some wound care, some antibiotics, get the calpoop out. What's the first? How do you help quick? You walk in and they have a catastrophic bleed. Somebody bring me a tourniquet, right? Do you need anybody to tell you to do that? Every emergency room has tourniquets. Y'all need to figure out where they at. Don't you say, where's the tourniquet? And they're bleeding to death. Clean the wound, suture staples, neuro assessment. Inspect it, vital signs and symptoms of shock. What kind of shock would it be? Hypovolemic. Diagnostics, same thing. You're not going to do a lumbar puncture on this patient. Why analgesics? If they pain, what does that do? Increases the heart rate, increases the respiratory rate, increases what? Oxygen consumption. Now they're going to get hypoxic. Now they're CO2. Do y'all see where we're going with this? It's the same continuum if you don't stop this. At the end of the day, if you don't do nothing for every patient, they're going to wind up in shock. A linear is just that. Usually these aren't bad. I got hit in the head with something. Now it still hurts. What is this? Who's that? Humpty Dumpty. Part of their skull does what? It shatters. How hard do you think this is to fix? Bad. You're going to go in there and pick all these pieces out. And it really, I have seen that where it really looks like Humpty Dumpty who had a bad fall. Now, what is this? It is bent in. What
kind of fracture? What'd you say?
Concave.
It is, what's another word for this when talking about fractures? A depressed skull fracture. If I'm feeling on your head and it's like, first thing I need to do is ask the family what? Is there a skull normally? Oh, girl, that's been there forever. Okay. If they say, can this be bad?
Yes.
What if it's open? Guys, I had one of the pilots I flew with, his daughter fell off the couch. They took her to Vandy, and what? She had a girl, they called. It's what they were supposed to do. It didn't really match. And then they found out, well, she fell, and she was young. They called DCS. Now, they started talking to them and figured out what? I don't think this is what happened. She didn't have any other injuries. Stop. I'm pushing the light. Where's your basal skull? It is the base. What's the problem when we get in a hole? Here. It leaks stuff out. The stuff is what? Cerebrospinal fluid. Where are you going to see it? This is important. Ears and nose. How do I tell? And this is the coolest thing ever. It's not cool because they have this injury. How do I tell? What color are most sheets on the bed? White. And you see this stuff dripping out and you're going to look at it and you're like, oh my God, what's happening? What do they call that? What do angels have? A halo test. The CSF is made up of a lot of different things than blood. And you'll look at it and the blood's in the middle and what? And it spreads out and it makes a halo. And it is obvious. I have seen it twice and I'm like, oh my God. Oh, I need to do something. The bad one, the guy got shot in his eye. The only reason he was alive is he was 18. He died later. This was at Tenova. And then we flew him out, and I think the guy out in the parking lot had a gun. This was not my best day. And I texted Dr. Ruffin, and she was like, called me back immediately. Are you okay? Yeah. What's that? You see it? That's the halo test. Now, if you can't see it, circular, guys, it is obvious. If that's leaking out and it doesn't do that, it's not what? It's not cerebrospinal fluid. What is this? What's the other name for that? Yes, ma'am. This is peri-orbital ecchymosis. What's the name for a bruise? Ecchymosis. Is this a significant blow? Is this a sign of what? Now, a basilar skull fracture. Is that always? It's not. Sometimes you can, if all the picture don't fit, now if you walk in there and they got this and they're leaking spinal fluid, then it's probably that. None of the other ones do that. Unless this is broke, and this is broke, and this is broke. Does anybody know where this trauma usually occurs? Mandible, the face, or if you had enough force that you just broke. Because you think about it, if you got thrown out, can you just impact that bone? Not usually. Now, you gave that answer, Jennifer. What is this? Battle signs. Guys, that takes a significant. Now, if you see this and this, and that, yeah, that's what it is. Stuff ain't supposed to leak out your nose if you ain't sick. What is our priority? Airway, they got a hole. What can get in? Bacteria. Infection is the number one thing that kills them. Because if you get an infection in there, what happens when you give them antibiotics? It can't cross you can't just squirt it up in there. It doesn't cross the blood-brain barrier. And a lot of the ones we use don't. Once that infection gets up in there, it's hard to get rid of.
it's gonna be airway, cause you can't let their GCS might not be high enough for them to follow commands and maintain their airway. Battle signs. Raccoon eye. Does anybody know what hemotympaninum is? Blood behind the tympanic membrane. Now, y'all, I suck at looking at folks' ears. I can see the crickets and the grasshoppers, but I can't. I don't know. Here again, neuro exam, but I'm gonna pay attention to something that I've never really looked at. Well, you're gonna look at it on all these patients. Is there something come out of their ears, something come out their nose, vital signs, GCS. I'm gonna control pain. Do y'all see the similarities here? We do most of the same thing on all of them, but what else? CT scan, MRI. They might sample what's coming out. Antibiotics is it's like a septic. Might they get septic? I sure don't want that. I don't. So you've got diffuse and focal. What's the difference? What's that? This is what we're worried about. This is when you get your bell rung. What happens? When is this usually happen? Fall. Sports injuries there's been a lot of studies on this. What happens to our football players and soccer years later? Everybody's committing suicide. Well, they have figured out that I ain't supposed to get hit upside the head that much. Now they've got monitors in what? The helmets. And if that gets too high, they will pull that player. Because they have figured out, hey, this ain't good for this patient. Where else do we get concussions? What have we not mentioned? MVC. And usually it's what? A rear end. And so they hit you and what happens? Your brain goes forward, your skull goes forward, your brain goes forward, and your brain goes back, and your head snaps back, right? Diffuse axonal, it's affecting what? Your axon. Now, is this bad? This is diffuse axonal injury. This is awful. What kind of injury, what kind of movement is their brain making? It's shearing. In that DAI, diffuse axonal injury, it shears and it disrupts and pulls all of those axons apart. What is the one thing your neuro system will never do? It'll never fix it. So sometimes if you have a heart attack, you'll get what? Collateral flow, right? Your body's starting to say, oh, I gotta work around your brain. That's it. You only get one set of cells, and if they destroy it, nothing. They're not coming back once they die. Now, there's all kinds of studies out there, and it might not be that from 5 years from now. What are focal injuries? It's your bruise. It's right here. It's not all over. What else? What are the 3 or 4 that I'm going to talk about? Epidural, subdural, arachnoid, usually it is subarachnoid. And what's the last one that I told you was bad? Intracerebral. Each one of these has their own signs and symptoms. Both can signify that you have had major trauma to the brain and head. For patients with concussions, and these don't test your inner gangster, they might have a brief loss of consciousness, and we wake up. What happened? Sir, you were in a bad accident, this happened, and you're going to call your mom. Okay. What happened? You're in a bad accident, they're going to ask you that 500 billion, 50, 11, 12,000 times on the way to the hospital. They don't remember what you told them. It doesn't happen every time. And does every one of them pass out? No, but you might see that. Retrograde amnesia. I don't remember what I said 5 seconds ago. Headache, nausea, dizziness, blurred vision. Do these people usually get admitted to the hospital? No. Guys, I'm telling you, this is bad. This is the ejected patients. This is a multiple rollover where their brain is just going back and forth in their skull. Most of the patients that I got, when we figured this out, they were already posturing. Their brain stem is what? It's herniated, hypertensive, hyperthermia, bradycardic, what we talking about? Cushing's. Recovery equals severity. This is what we're talking about. Coup contra coup. This is a primary injury, but you got what here too? You got an injury back there. This is not the fallout. You hit your skull, it falls back, and your brain hits your skull. Now you might impact the windshield right here, and it impacted your skull too. Cerebral contusion is not on your test. This is the absolute emergency. This happens quick. Epidural, subdural, and intracerebral, and subarachnoid. These x-rays are important. You know, I always get confused about the concave and convex. It's gonna make a bowing out, and it's like a half circle. That's white. What is that? Will you not see? No ventricles. It started to what? Shift. There you go. There's blood, and it's that formation. Subdural does not look like that. It looks like a crescent moon. Why am I telling you this, board? You're going to get a case scenario, and you'll see that.
This one is
This is the epidural. This is a neurologic emergency. They are actively hemorrhaging. Which artery, usually? I have to look at this so I can pronounce it. The middle meningeal artery, about 90% of the time. And what have I said like 4 times? Artery. Is this a venous bleed? No. How quick do you bleed to death if I cut my popliteal artery? Pretty quick. It's bleeding arterially in your head. What is your ICP going to do immediately? Shoot up, because you don't have long. Agitation, sudden headache. You walk in, they say, my head hurts, and they go unresponsive. Absolute loss of consciousness. And they don't come back. Well, yes they do. Sorry. Short period of unconsciousness. You walk in there like this, Mr. Jones, and a few minutes later they what happened? Guess what happens after they go out again? This doesn't happen again. What's happening in their head? Their ICP is going. So, short period of unconsciousness followed by what's lucid. I can make sense, right? That's important too. If you saw that and you saw this, what kind of bleed? Epidural. Guys, I cannot impress to you enough. That is an absolute neurologic emergency. I'm not saying that, see what I'm saying? It looks like a crescent moon. What's that? That's your other ventricle. What happened? You got a bad abdominal chip. You see that? That ain't supposed to be there. What happened is gone, and they kind of merged. Subdural, crescent moon. Now, how would a chronic, what kind of patient do you think this would be? What happens when you get older, especially like 70s, 80s? Your sub-Q tissue goes away. What happens to your brain? It shrinks. What does that make more space? If I fall down and go boom, what does that give my brain more room to do? To bounce around. Now, this patient's going to be brought in by the ambulance, and they were at the nursing home. They were fine. And somebody said, you know they fell 6 days ago. What kind of bleed? It's a chronic subdural. When they fell, it started leaking a little bit. Now, did I say automatic, like unconscious, lucid? No, I did not. and this usually happens in the older population because that brain does shrink. They may not make as much cerebrospinal fluid, and when they fall down, it's just a ping pong ball in there, and it's going to tear something. Is that arterial? It's not. They would have died. Signs of increasing ICP. Have y'all seen that word before? Headache, nausea, vomiting, dizziness. Why not that surge speech? What else can, if they haven't had a TBI, it's a subdural hemorrhage, it's a stroke, right? It's the same signs and symptoms, but what has to be associated? Trauma. We're not talking about stroke. We're talking about a traumatic brain injury. If you can't have sepsis without infection, right? You can't have a TBI without trauma. This picture is not going to be on there. What does that look like? A starfish. This is called the starfish of death. Isn't that pretty? Have y'all heard me say, this is the hallmark sign. This is an elephant sitting on my chest. Hey, I've got a ripping, tearing pain between my shoulders and my blood pressure's dropping. They got an aneurysm and they're dying. This is the worst headache of my life. And guys, I don't know where this thunderclap comes from, but this is an elephant. This is a ripping, tearing. This is a pressure. It felt like a thunderclap when it came on. Sudden, worst headache of my life. Nausea. What's that? My second or third now. What's the horses wear so they don't get spooked? Blinders. So I was judge and jury. I'd been awake for 27 hours on the ambulance. I walked in and this woman's got a headache. She got migraines. Come on. She was laying on the floor. Oh my God, my head hurts. And white balls in my eyes. She got migraines, right? We got her to the hospital and what? She had a subarachnoid bleed. Guys, don't do it. We all do it, right? Just try not to. You've got to realize that you are presenting this bias. Y'all need to dig deep and figure out what that is. It's called self-reflection, right? We all have them. You might not realize what they are. This is just showing you the different types of bleed. Treat the cause. You guys, this is broken into two parts. What time is it? The next time we come back, we're going to stop here. The next time we come back, how about we start over and you guys can ask me questions about all this stuff we have covered. And if anything's really muddy, we'll go back over it. Is that fair? Did everybody get the study guide? Did y'all look? Is it online? I think it is. Okay. That PowerPoint that's on there is the new one that shows the brain stem, that shows the anatomy and physiology. Guys, I ain't being mean when I do it, but y'all ain't the first class. I'll ask a question there like that's the brain stem.